What were the three first concrete steps that it took once this idea became a reality?
I'm going to take a little bit different approach here because I think it would be easy to say, well, okay, we have an idea, so then we do a business plan, and then we do a financial model, and then we
Right,
do
right.
this. I've had a lot of time to sit and reflect, and this is probably a bit with age and hopefully a bit more maturity. Is that the first step was, who am I? Um, what are my strengths? Where am I not as strong in business? What are my weaknesses? What do I really bring to the table? What are the things that I don't know? Um, I had to do a lot of like deeply introspective work on myself as a human being and an entrepreneur, which having a couple companies before this, I definitely did not do that. It was far more based on ego and, hey, we're going to do this and we're going to do this better than other folks. And so for me, it was the first step was really taking a step back and saying, what am I missing? And for that, I had to talk to people. I had to again do a lot of my own work. I had to get to the place where I started to be able to see what I wasn't able to see. Talk about like being an expert on not being the expert.
Right.
So
Yeah.
like, what am I not? What don't I know about myself? What and really, it comes down to like, what are my particular skills? The second step was then having a bit of understanding of that, of who I am as an entrepreneur and as a human being. Who else do I need?
Right.
Right? And
Yeah.
so, the idea for Ava Health is a big one, and we have a big vision. And the only way to do that is by then bringing in minds and people that just have skill sets that are incredibly complementary to me. So that's like why we're sitting on a couch, and in all of this is because I began to say, okay, like there's no way that I'm going to be able to do this solely on my own. It's being able to really align and bring those people together that are able to offset the areas I'm not as strong in and my weaknesses. And so like, if that's the second one, then the third one is like, okay, well, it's one thing for people to tell us that these are the problems, and
Yeah.
and to spend the time doing research and interviewing people and collaborating with people, at the state and the region and the local areas and all of this, but also was then to really go out and do a lot of our own research and talk to communities and talk to providers and to really be able to then take what was somewhat of anecdotal information but then is really to dial in like, what is the demand, right?
Yeah.
Like, what are the actual problems that exist? And I say that because the last 5 years, prior to Ava Health, had really spent in consulting and advising and helping startups. And a lot of times people would come to me and they would say things like, I drove down the street and I saw like all these homeless people, and then I saw this article in the newspaper on all these drug overdoses. It means that like in our community, like that's exactly what's needed. And it was this very, very surface level kind of concept of, well, if we build it, they will come.
Right.
Instead of really diving into like, what does this specific community need? And I use the example of, how many times I got a phone call from someone saying, I want to build a 6-bed private pay detox in Los Angeles. And like my heart would just kind of sink, and I would think, there are probably 20,000 private pay detox beds in Los Angeles County.
Yeah.
Why in the world would you do another one? Like, start to think a bit creatively. And the only way to do that is to understand what are the problems that this actual community has.
Right.
And I can just tell you, like, problems in major metropolitan areas of the United States are not more private pay, high-end residential beds. And so, again, I know I like get down a rabbit hole or like tangent a little bit on that, but
Sure.
the ability to step back and say, look, I've got passion, I've got heart, I really want to serve, I really want to help. For whatever reason, that we're working in this beautiful industry, it's also like, well, what is the actual problem that exists, right? And so, even to take it a step further, how many times people pitch ideas or concepts to me and they can't actually speak to what the problem is. So how do we build a business or raise capital or grant funding or whatever it is if we don't actually know and can't speak really specifically to what is the actual problem, right? So anyways, the three concepts for me that became really concrete in the process prior to a business plan and a financial model and raising money and all of this stuff was like, I had to look deep within as an entrepreneur and a human being and say, who am I? What are my gifts? What are my skills? Also, where am I really lacking? And what are the things standing in my way of being the best entrepreneur human being that I can be, the best partner I can be? Then aligning with other people that have these skill sets that are complementary and are able to come together and create this like incredible fusion. And then number 3 is like actually figure out what the problem is. Go in, talk to people, understand communities, understand what the demand for the specific service was going to be. So anyways, long-winded way of kind of diving into those 3 ideas.
Thank you.
Hello, Ava Health.